proudly presents Dr. Pamela Ortain Smith. Dr. Smith, thank you.
Thank you so much.
Have a great smile.
Thank you. For those of you on the East Coast, good evening. It's probably good afternoon for some people who are joining tonight. We could really talk about LDN, honestly, for 3 or 4 days. Low dose naltrexone is a fabulous anti-inflammatory agent. I use it for every single autoimmune disease there is. Tonight, we're going to talk about one of those, atopic dermatitis and eczema. I use it for weight loss. I use it to prevent memory loss, treat memory loss, almost anything that's inflammatory in nature, including post-COVID syndrome. We are looking at using LDN in. So tonight, we're just going to take a nice look at atopic dermatitis and eczema. And we'll finish off by looking at LDN and kind of wrap it together from that format. So there are some references. As you all know, atopic dermatitis is a pruritic hereditary skin disorder. It is the most common form of eczema. The lifetime prevalence is 10 to 20%, with many cases starting as a baby, and 20 to 40% of people continue to have atopic dermatitis as an adult. Conventional therapies are effective for some people, but they only suppress the disease. They really do not fix the etiology. And that's what I love about the kind of medicine that we all practice. You know, many different terms are used between anti-aging, functional medicine, precision medicine, personalized medicine, integrative. There are many. But we all have one thing in common. Besides wanting to help the patient, we want to look at the cause of the problem. And traditional medicine, and I am a very traditionally trained doctor, I believe in traditional medicine, but fortunately, all of us have a bigger bag of tricks where we can literally look at the cause of the problem. The diagnosis of atopic dermatitis does require 3 major and 3 minor features. There's 22 minor features, and that really shows the extent of the atopic dermatitis. It can be very different from patient to patient. So these are the diagnostic criterion. Here's the major features, and certainly pruritus is the most common that you will have. Here's the minor ones. I'm not going to bore everybody by reading them. I think everybody pretty much knows this disease process. But if I had 3 hours tonight, I could add rosacea, acne, psoriasis. All of those do very well by looking at all these therapies plus low dose naltrexone. And here's minor features. I think the only one on here that I had not really thought about before was cataracts. I never thought about cataracts as part of atopic dermatitis. Pathophysiology, several factors really combine to make this disease: genetic, immunologic, and environmental. And a family history of atopic dermatitis is a major risk factor for someone